Hi everyone, welcome back to our channel. Today we're diving into a topic that every parent, caregiver, or guardian needs to know about: the symptoms in babies that you should never ignore. Babies are amazing little beings, but they can't tell us when something feels wrong. That's where we come in. It's up to us to observe closely, trust our instincts, and take action to ensure their health and happiness. Parenting is an incredible journey filled with moments of joy, love, and discovery. But let's be honest, it can also feel overwhelming. There's so much to learn, and sometimes it feels like there's no handbook for the right way to handle every situation. The good news is that your instincts as a parent are incredibly powerful. If something feels off about your baby, trust yourself. Reach out to a healthcare provider for guidance because your baby's health and well-being are worth every bit of caution. Today, we're going to cover key symptoms in babies that you should never overlook. Whether you're a first-time parent or you've been through this journey before, this information is invaluable. So, grab a cup of tea, get comfortable, and let's empower ourselves with knowledge. A common concern that comes up for many parents is fever. Fevers are often the body's way of fighting off infections, but for babies, especially newborns and those under 3 months old, a fever of 100.4 degrees Fahrenheit or higher is considered an emergency. At this age, a baby's immune system is still developing, making even a mild fever potentially serious. For babies older than 3 months, you can monitor fevers a little more conservatively. However, there are still signs to watch out for. Is your baby unusually sleepy, fussy, or refusing to eat? Are they showing other symptoms like difficulty breathing, a rash, or seizures? These are moments when it's important to act quickly and seek medical advice. Remember, fevers are not the enemy. They're a signal from your baby's body that something might need attention. Let's move on to a symptom that can be particularly alarming: difficulty breathing. Babies naturally breathe faster than adults, and this is normal. However, their breathing should always be smooth and consistent. If you notice that your baby's breathing seems labored, unusually fast, or irregular, it's time to investigate further. Pay close attention to signs like flared nostrils, grunting sounds, or the skin pulling in around their ribs or collarbone when they breathe. These are called retractions and indicate that your baby is working harder than usual to get air. Another red flag is a bluish tint around your baby's lips or fingertips, which could mean they're not getting enough oxygen. Breathing issues in babies can stem from several causes, including respiratory infections, allergies, or even conditions like asthma. One common culprit is bronchiolitis, often caused by viruses like RSV. This condition can make breathing extremely difficult for little ones. If you notice any of these symptoms, don't wait. Seek medical attention immediately. Next, let's talk about vomiting. Babies spit up frequently, especially after feedings, and this is usually nothing to worry about. However, persistent vomiting or projectile vomiting can be a sign of an underlying issue, such as pyloric stenosis. This condition causes the opening between the stomach and small intestine to narrow, leading to forceful vomiting after meals. It's more common in young infants and requires prompt treatment. Vomiting can also lead to dehydration, which is dangerous for babies. Signs of dehydration include fewer wet diapers, a dry mouth, or a sunken fontanelle, the soft spot on your baby's head. If you suspect dehydration, consult your doctor immediately. Babies can become dehydrated quickly, especially if vomiting is accompanied by diarrhea. Speaking of the fontanelle, changes in this area can reveal a lot about your baby's health. A sunken fontanelle often signals dehydration, while a bulging fontanelle, particularly when paired with fever, vomiting, or lethargy, might indicate increased pressure in the brain. This could be caused by conditions like meningitis or hydrocephalus, both of which require immediate medical attention. Another symptom that often causes worry is seizures. Seizures in babies don't always look like the dramatic episodes we see in adults or on television. Instead of full-body convulsions, they can involve subtle signs that are easy to miss, such as repetitive jerking of a single limb, stiffening of the arms or legs, or even brief episodes of staring into space. Sometimes these movements might be mistaken for normal baby reflexes or twitching during sleep. However, if you're unsure, it's better to err on the side of caution. If you think your baby might be having a seizure, the most important thing is to stay calm. Lay your baby down on a flat, safe surface and turn their head gently to one side to prevent choking if vomiting occurs. Do not put anything in their mouth. Observe the episode closely, noting how long it lasts and what specific movements or behaviors you see. If possible, record the episode on your phone. This can provide valuable information for healthcare providers, helping them identify the type of seizure and determine its cause. Seizures can happen for various reasons, such as fever, febrile seizures, low blood sugar, infections like meningitis, or even underlying neurological conditions. While some seizures may resolve quickly and cause no long-term issues, others require immediate medical attention. If the seizure lasts longer than 5 minutes, call emergency services. Even shorter episodes should be discussed with your pediatrician to rule out any serious underlying conditions. Remember, seizures are a symptom, not a disease, and identifying the root cause is crucial for effective management and your baby's well-being. Let's shift gears and talk about rashes. Babies are prone to developing rashes, and in most cases, these are harmless and resolve on their own. Common examples include diaper rash, heat rash, and even baby acne. However, certain rashes require closer attention and immediate action. One such rash is a purplish or reddish one that doesn't fade when pressed. This could be a sign of meningitis, a potentially life-threatening infection. Other concerning rashes might appear alongside fever, swelling, or blisters. For example, hives can indicate an allergic reaction, while blisters could point to a skin infection or a viral condition like chickenpox or hand, foot, and mouth disease. If the rash is spreading rapidly, appears painful, or your baby is unusually fussy or lethargic, it's important to seek medical advice promptly. When dealing with any rash, consider its location, appearance, and whether it's accompanied by other symptoms. Diaper rashes, for instance, are typically localized to the diaper area and may respond well to over-the-counter treatments. In contrast, widespread or unusual rashes should be evaluated by a doctor. To manage and prevent everyday rashes, ensure your baby's skin stays clean and dry. Use mild, fragrance-free soaps and detergents, and avoid clothing that could irritate sensitive skin. If you notice anything unusual about your baby's skin, don't hesitate to reach out to your pediatrician. Skin conditions in babies can change quickly, and early intervention can prevent discomfort and complications. Feeding is another area where concerns can arise. While it's normal for babies to go through phases of eating less, persistent refusal to eat or drink can signal a more serious problem. Teething, minor colds, or temporary discomfort may explain occasional feeding issues, but consistent refusal over several feedings warrants attention. Sometimes feeding difficulties are linked to infections, such as an ear infection that makes swallowing painful, or a sore throat caused by a viral illness. Gastrointestinal issues like acid reflux or a milk intolerance can also lead to discomfort during feeding. Additionally, structural concerns such as tongue tie may make latching or sucking difficult for your baby. Poor feeding not only affects your baby's immediate nutrition, but also poses risks for dehydration, which can be dangerous for infants. Watch for signs such as fewer wet diapers, dry lips, or lethargy. It's also helpful to monitor your baby's weight and growth. Regular checkups with your pediatrician can ensure they're staying on track. If your baby continues to refuse feedings, consult a doctor to rule out underlying issues. In the meantime, you can try offering smaller, more frequent feedings or experimenting with different bottle nipples or breastfeeding positions to improve comfort. Remember, feeding challenges can usually be addressed with the right guidance, and early intervention ensures your baby gets the nourishment they need. Babies cry. It's how they communicate their needs, but inconsolable crying can sometimes indicate an underlying issue that requires attention. Normal crying can stem from hunger, a dirty diaper, or the need for comfort, but persistent, high-pitched, or unusual crying could be a sign of something more serious. One common cause of inconsolable crying is colic, a condition where otherwise healthy babies cry excessively, often in the late afternoon or evening. While colic is not harmful, it can be distressing for both babies and parents. Another possible cause is acid reflux, where stomach acid irritates the esophagus, causing discomfort, especially after feedings. Infections, such as urinary tract infections or ear infections, can also lead to prolonged crying due to pain. Babies might tug at their ears or seem uncomfortable lying down if an ear infection is the issue. If your baby's crying is accompanied by fever, vomiting, or changes in behavior, it's essential to seek medical advice. To comfort your baby, try soothing techniques like rocking, swaddling, or using white noise. Sometimes a gentle massage or a warm bath can help ease discomfort. However, if your baby's crying feels different or more intense than usual, and you're unable to calm them, trust your instincts. Your pediatrician can help identify the cause and recommend appropriate care. Now let's discuss stool changes. A baby's stool can vary greatly depending on their age, diet, and health. For breastfed babies, it's normal to have frequent, soft stools, while formula-fed babies may have fewer, firmer bowel movements. However, there are certain changes in stool that can signal a problem. Diarrhea, especially when watery, bloody, or containing mucus, can indicate an infection, food intolerance, or even a reaction to antibiotics. Persistent diarrhea can quickly lead to dehydration, so it's important to monitor for signs like fewer wet diapers, a dry mouth, or a sunken fontanelle. On the other hand, constipation, while less common in newborns, can cause concern if your baby is straining excessively, passing hard stools, or seems in pain. Changes in color can also provide clues. Black terry stools might indicate digested blood, while white or clay-colored stools could suggest a problem with bile production. If you notice any of these unusual changes, contact your pediatrician. In many cases, stool changes resolve with simple dietary adjustments or time. However, persistent or severe changes should not be ignored. Keeping track of your baby's stool patterns can provide valuable insights for your doctor, helping them pinpoint the cause and ensure your baby stays healthy and comfortable. Finally, let's talk about your baby's alertness and activity levels. While babies sleep a lot, they should be alert and engaged during their awake times. If your baby seems excessively sleepy, unresponsive, or less active than usual, this could indicate an underlying issue that requires medical attention. Let's take a moment to recap. We've covered symptoms like fever, breathing difficulties, vomiting, dehydration, changes to the soft spot, seizures, unusual rashes, feeding problems, inconsolable crying, stool changes, and lethargy. These are all signs that something might be wrong and that your baby could need medical care. Parenting is one of life's greatest joys, but it also comes with challenges. Remember, you're not alone in this journey. Trust your instincts, lean on your support network, and never hesitate to reach out for help if something doesn't feel right. It's always better to be cautious when it comes to your baby's health. Thank you for spending time with me today. If you found this video helpful, please give it a thumbs up, share it with other parents and caregivers, and don't forget to subscribe to our channel for more baby care tips and parenting advice. We'd also love to hear from you. Let us know in the comments what topics you'd like us to cover next.